most famous physical therapist on the internet.
Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet, in our opinion. I'm Bob Schrupp. I'm going to be your host today. I'm exactly one half of the Bob and Brad team. I'm joined by Chris the Pharmacist, who is, as I've said before, one of the smartest guys I know. And that's a compliment, Chris.
Appreciate
So
that.
today we're going to talk about, should you use St. John's wort for depression? And it's funny because you brought this up to me a while back, and then I had a nurse practitioner mention to me that, you know, if you are having trouble with anxiety, or you maybe want to try it. I know you were kind of against it.
Yeah, you have to be careful. I mean, St. John's wort has a place in the role of treating mild to moderate depression, but the problem with St. John's wort almost exclusively is just the amount of drug-drug interactions that it can cause. And if somebody's already on a medication, that would be very, very dangerous recommendation.
Yeah, so I mean, we're going to name some of the drugs.
Yep.
I looked up some, and it can also affect, they're not sure how it affects pregnancy.
With respect to pregnancy, I mean, right now, St. John's wort in and of itself, most of the research has been done by Germany, and the German
Right.
monograph E is kind of the Bible for all these type of herbal remedies for, any type of health condition. But with pregnancy, there's just not enough data that really supports safe use of it. I mean, right now in the prescription world, really the safest choice is probably sertraline, but, it's interesting pharmacologically when you look at St. John's wort, it's kind of got the best of all the prescription worlds. It's got your monoamine oxidase inhibition, it raises serotonin, it raises norepinephrine, and it raises dopamine. So when you take all those together, I mean, you would think on paper, at least, it would look really good. But when you're looking at something as important as being a pregnant woman, the last thing we want to do is take any chance in causing any problems. And right now,
the same holds true for children. I saw they didn't really have
They
research
don't
on
have
that
a
either.
lot. I found a couple of studies that suggest that if they're, over the age of 12, that maybe half the adult dose, which for an adult is 900 milligrams 300 milligrams 3 times a day, or 900 milligram total daily dose. But I would be reluctant to use it in children as well, because there's just, I don't think, enough data that really
Sure.
plus or minus. At the end of the day, though, I mean, children are pretty much small adults as they start to age. But, there's a point where, with growth spurts and adolescence, there's a lot of brain chemistry that's changing. And even in the prescription world, it's becoming used more now with the pharmaceuticals. Some kids with depression issues, anxiety issues, that they will use a prescription. But this is more of an unknown. I would be really reluctant, and again, just because of all the drug-drug interactions, which we'll certainly touch on.
You were saying in Germany that it's actually a prescription drug.
In Germany, it's specifically a prescription.
And used quite a lot.
Used a lot.
Yeah,
I mean, probably even more so than even some of the prescriptions, which is one of the,
it's funny, I was looking at studies, and a lot of the German studies were positive.
Well, they
towards
are.
it.
They are positive, in certain circumstances. And I think when you take the Americanized studies, which are based off of all the German studies, they show that at least compared to other, and they use placebo, and they use actually head to head, they use pretty much what we would call moderate or low doses of the other, they call second generation antidepressants. So that's pretty much anything that was invented after the 80s. So it's kind of everything that we use today. When it stands up, I mean, if you are going to take St. John's wort as a single agent with nothing else in your system. For mild or moderate depression, I would say it's okay to try as long as your doctor is on board. And then, you really have to touch on with the doctor. I mean, you cannot use over-the-counter cough and cold preparations that contain pseudoephedrine. You have to stay away from, cured meats, aged cheeses, red wine, beers. I mean,
wow, so
alcohol.
It's not just other meds.
No, it's everything. I mean, and that's why I have a hard time supporting
that
it.
list. I saw.
It's intimidating.
Well, obviously, if you're going to go on antidepressants, you shouldn't be doing that. I mean, if you're going on
correct.
But I saw birth control pills,
blood thinners, HIV medications, cyclosporine, which would be used for organ transplant, narcotic, digoxin for your heart and other heart medications.
Some HIV drugs,
correct.
Some cancer medications,
absolutely. So, and that's the thing that makes it so it's metabolized in our livers, so cytochrome P450 system. And what it does, it actually can influence either making some drugs go higher in your system or go lower in your
Sure.
system. And that's why the danger exists. And, to the average person, unless you ask your pharmacist or if you consult your physician or practitioner, a lot of times, and even then, look at the example with the practitioner you came up with, where a nurse practitioner said, well, why don't you use this? Well, I'm already on something. And that, when you take it with other antidepressants, increased risk for seizures, serotonin syndrome. I mean, there's some things
what
that
I'd
we
read. It
have to be
increases your
careful.
body's serotonin levels to possibly a dangerous, life-threatening level.
Correct.
Right?
I mean, it's a rare interaction to begin with, but to me, I mean, I am conservative by my nature and my recommendations. I mean, the only thing I care about is patient safety. I mean, and good results. So I should say two things. But I mean, the reality of it is that we want to make sure that if you're going to choose to do something like this, that you are acutely aware that St. John's Wort should be used with absolutely nothing else.
Well, the other thing is that we don't want to encourage you to try to treat depression on your own.
No,
And St. John's Wort could possibly do that if
Yeah, well, it's available on any drug
That's what
counter
I
or
mean.
any internet. I mean, you go on Amazon and there's 100 different versions of it. So, but I mean, the biggest thing is you want to see your doctor first, because let's rule out maybe there's something else that's the cause
Sure.
of the issue. And so if we really don't, and I mean, if you want to have the discussion with the doctor, well, I'd really like to try something more natural, because I will tell you that St. John's Wort does tend to have less side effects than the prescriptions. So that is an attractive advantage. And again, I think that's why in Germany it's used so frequently, is because it's, when used in itself as a singular agent with no other prescription medications over the counters, you have a relatively comfortable existence with it.
I mean, when you started mentioning those foods, and you also mentioned alcohol, as far as there's three that you could. Was it?
Yeah, oddly enough, bourbon, you can use vodka, and you can have rum. So
I could get by.
So, I mean, nonetheless, not that we're going to encourage it, because
Right.
alcohol is a depressant, but I mean, those are the three. But yeah, you can't have dark beers, you can't have red wines.
How about white wines?
White wines, actually, there's some white wines that you could, like a Chardonnay.
Oh, really?
So
Well,
yeah,
that's some types. So
some
I mean,
types.
you gotta
really
watch
have
yourself.
to be very, very careful. And to me, I'm to me, the reason I give the thumbs down on it in many cases is because most of us, inadvertently, you'll be taking the medication. Let's say things going well 12, 15 weeks down the road, and you kind of are, not, I
Yeah.
guess, post COVID, maybe everybody gets their vaccine, you're out and about, maybe you're out at a restaurant. What if you had, like some sort of
Sure.
fancy, protein-based meal, and you wanted to have a glass of wine, and all of a sudden you chose the wrong one. Now you're creating a tyramine reaction, which can be pretty severe. So we have to be super careful with its usage, and that's why it's easy to just slip up once, but it only takes one to create a real problem. And all of a sudden, what turns into a pleasant night ends up in an ER.
I did see some studies too that showed it was not as effective, which they always
There
is.
are.
Yeah,
I mean, and,
they were saying it was not even as good as a placebo in one
Yep.
study.
Some of the older studies have said that it really doesn't. Some of the more modern ones do. And I think
Sure.
it just comes down to, I mean, we are constantly, when we're researching these types of things, and when doctors and practitioner groups and university settings are doing solid research on medications, they're looking at the old studies and saying, well, what if we approach this angle? And that's the unique thing about this field in healthcare in general, is that we're always looking to find ways to improve. Maybe we didn't look at the study appropriately the last time.
Sure.
So endpoints and things that they look at for specific markers. So
Yeah, it's
really
really
hard.
rare to find that they give thumbs up to a drug consistently on studies.
Oh yeah,
Yeah.
and and again with St. John's Wort, I mean, realistically, I mean it has a place as long as it's a singular agent. You're on nothing else. I mean, I can't stress that enough.
And that's
you really,
rare.
and you want your doctor involved. I
Yeah.
mean, because like I said, there's other things that we have to rule out. And I would hate to kind of go on this journey and then haphazardly be taking something, or let's say you were taking a thyroid medication and maybe all you had to do is have the dose adjusted, and also now we take the St. John's Wort, and now we've really negatively inhibited your thyroid production. So
And warfarin.
yep,
I
warfarin,
read,
blood thinner, and
very common.
Yep.
A lot of people on warfarin.
lots of people
So-
are. We're going away from it because we have some of the better, newer
Oh, you do?
anticoagulants. But warfarin still has a strong place in medicine, and we're going to use it for years and years to come. And again, that'd be something that all of a sudden maybe you're a little low and you're not really thinking about it. And you're like, yeah, I've been on warfarin for 5 years because I've got an issue with the heart. And I'm feeling a little low. It's COVID. I'm isolated. St. John's Wort I read on the internet says it's good for depression. Well, now you've created the bleed risk. And now, could you have had a life-threatening bleed? It's scary.
Sure.
So, and that's the concern that I have.
So we want you to go into this drug with eyes wide open. And I think Chris has covered it very well as far as what the downsides are possibly. So please proceed in that fashion.
Absolutely.
All right. Thanks for watching, folks.
Thanks, everyone.